Approximately 5 to 10% of all cancers are hereditary in nature. Using DNA sequencing, people with a family history of one of these cancers can determine if they have the genetic predisposition and make informed decisions about preventative treatments. Diagnostic genomic testing is rapidly becoming a standard of care for many hereditary conditions and cancers because such testing has greater capacity to detect disease-causing mutations in comparison to conventional diagnostic approaches. Traditionally, the methods used to identify these genetic alterations have been labor-intensive and expensive and have failed to keep pace with demand, resulting in an accumulated backlog. Recent advances in DNA sequencing techniques have shown great promise in the ability to examine significantly more genetic alterations at a lower cost and with sufficient capacity to meet growing demand. The Center for Clinical Genomics was established to provide more accessible genetic testing for British Columbians through application of novel technologies and is the first and only clinical laboratory in the province to implement next-generation genomic sequencing for genetic diseases. Based in the Michael Smith Genome Sciences Centre at the BC Cancer Agency and supported by the Provincial Health Services Authority, other partners include the Lower Mainland Pathology and Laboratory Medicine Services and the BC Cancer Agency's Cancer Genetics Laboratory and Hereditary Cancer Program. The project has been successful in applying next-generation sequencing technology to screen individuals whose family histories make them at risk for hereditary breast and ovarian cancers at a fraction of the cost of conventional testing. In the last year, this new technology has eliminated a testing backlog and reduced turnaround time by 64%, while decreasing overall cost by 25%. It has also widened the scope of genetic testing in BC by launching a panel that combines 14 individual genes into a single test at the same cost as sequencing only 2 genes. Previously, only 5 of these genes were tested in BC, while the remaining 9 were tested outside the province. Cancer predisposing mutations are now being found in many more BC families for whom intensive clinical screening, earlier diagnosis, and more effective treatment can be made available. This forward-facing, collaborative approach to genetic testing will lay the foundation for future work and generate the capacity and expertise to address genetic testing needs for years to come. Today, we congratulate the Center for Clinical Genomics team for their innovative efforts in significantly improving care and outcomes for patients. Generously sponsored by Great West Life.